Welcome to Guardian Stars platform. My name is Mulundano and I'm going to take you through the nursing care plan. This is just an overview. It's a summary of what a nursing care plan is. I want to give you a glimpse so that you understand what a nursing care plan is. Okay, I don't want this video to last for more than 10 minutes. So let's go straight into our presentation. The main objective of this presentation is that you should be able to gain the necessary understanding of what a nursing care plan is. You should be able to utilize it. Okay, you understand the nursing care plan and be able to apply it. The specific objectives, you should be able to describe the nursing care plan, of course, and you should also be able to describe its characteristics. And the nursing care plan has got certain features that makes it stand out as a nursing care plan. So you have to identify those features and be able to describe them, explain them. The nursing care plan has got certain elements that you need to understand as well. So you should be able to discuss these elements of the nursing care plan. We are going to see them. Okay. You should also be able to describe how you can use the nursing care plan in order to when attending to your patients. So you should be able to apply this nursing care plan at the end of this presentation. At least you should be able to explain to someone how the nursing care plan is used. Okay. So how is the nursing care plan defined? The Porter and Perry in 2009 defined the nursing care plan as a written guide that organizes data about the client's care into a formal statement of strategies that will be implemented to help the patient achieve optimal health. Okay, so what Porter and Perry just defined the nursing care plan as a written guide that you yourself as a nurse, you write down that to guide you in the provision of the nursing care services to your patient. It helps you not to forget or skip important information or nursing interventions for your patient. Okay, by so doing, it will also help you to achieve, to help your client achieve their optimal health, because you will provide adequate healthcare service, you will provide adequate nursing interventions. Okay, you will provide adequate healthcare to your patients because you have planned for it already. It's always important to plan. Okay. A nursing care plan is a part of the nursing process. Of course, we obviously know what the nursing process is. And the nursing care plan is found in the planning phase of the nursing process. Okay, so this is more like a subset. Okay, it's a substitute of the nursing care plan, the nursing process. It's found in the nursing process. It's not a substitute, it's a subset. Okay, it's found in the planning phase of the nursing process. So it's part of the nursing process actually. Okay, because for you to be able to identify a problem, you will have identified that problem during the assessment phase of the nursing process. Okay, then after you identify that, after you identify the problem in the assessment phase, you have to now manage that problem. Under the planning phase, you plan for the problem, you make a goal, then you also put in your interventions, then evaluate yourself. So that's the main instance of the nursing care plan. Okay. The creation of the plan is an intermediate stage of the nursing process. Of course, it's an intermediate stage of the nursing process. It's found in the planning phase of the nursing process. Okay, and it's a very important part of the nursing process. We are going to see why it's important. You cannot graduate from a nursing college without learning how to use a nursing care plan. Because this is a tool that you'll be using in your provision of nursing services to your patients. Okay, regardless of what type of a patient, an individual, a group, a family, or the community, all those patients, you have to use the nursing care plan for you to be able to effectively deliver your services as a nurse. So what are the characteristics of a nursing care plan? The nursing care plan is holistic. The focus of the nursing care plan is holistic and is based on the clinical judgment of the nurse using the assessment data collected from the nursing framework. So the nursing care plan, what this statement means is that the nursing care plan is the nursing care plan focuses on the patient as a human being, as a whole. You do not just focus on treating the disease that the patient is presenting with or the disease that the patient is suffering from at that moment. You attend to the patient's psychological state, emotional, spiritual, and physical. So you have to take the patient as a whole being. Okay, so that's what the nursing care plan does. It makes you look at the patient as a full human being and attend to them as a human being, because you have to identify their needs and what is troubling them. Apart from the disease, what else is the patient suffering from that needs attention? Okay, so of course, its focus is holistic. Another characteristic of the nursing care plan is that it's based upon identifiable nursing diagnosis, clinical judgments, and about the patient. Okay, so the nursing care plan is based on the problem that you've identified. You can't come up with a nursing care plan if you've not identified any problem about this patient. What are you going to manage? What are you planning for? If the patient you have not identified any problem, what are you going to plan for? So the nursing care plan is based on the nursing diagnosis that you have identified. Okay. The third characteristic is that it focuses on client-specific nursing outcomes that are realistic for the care recipient. Okay, this is very important. The nursing care plan focuses on the outcomes of what you want your patient to achieve at the end of your nursing interventions. Okay, of course, I can say again that it's client-centered, because you make goals that are client-centered. Usually you make goals that are client-centered in the nursing care plan. It's not your goals as a nurse. It's not what you want to achieve at the end of your nursing interventions. It's what you want your patient to achieve at the end of your nursing interventions. Okay, so these goals must be very specific and realistic. Okay, there must be goals that can be achieved. It's a product of a deliberate, systematic process. Of course, we already mentioned that this nursing care plan is a product of the nursing process. It's something that you plan, you yourself as a nurse. You plan it systematically. Okay, it includes nursing interventions which are focused on the etiologic or risk factors of the identified nursing diagnosis. So the nursing care plan, the interventions that you put in place, they will always focus on the risk factors or the etiology, the causes of the condition of the problem that you've identified. You've identified the problem. Now, what are the causes of this problem? If you identify those causes, then you have to put in interventions in order to eliminate those causes. This statement simply means that the nursing interventions are usually focused on the etiology, on the elimination of the etiology or the risk factors of the problem that you've identified, or the causes of the problem that you've identified. So these nursing interventions are focused on eliminating that problem. The sixth is that it relates to the future. When you're planning, you have to focus on the future. You look at the future of the patient, of course. You do not just plan for what is going on now. That's why you set goals for the future as well. You say maybe in 2 days, in 3 weeks, in 1 week, or throughout hospitalization. You're looking at the future of the patient. Elements of the nursing care plan. The nursing care plan has got about 5 elements. The first element is the problems or needs. These are the problems that you've identified that the patient that needs intervention. Okay, these problems can be actual or potential. We are going to see how we can state these problems in the nursing care plan. Okay, the second element is the nursing diagnosis, which with related factors and diagnostic criteria. So the nursing diagnosis also is of two types. This is a clinical judgment that you make after you've carried out your assessment. The clinical judgment that you make about how the client is responding to the actual and potential problem. So we are going to see how we can actually design or construct the actual problem, the actual diagnosis, and the potential diagnosis. Okay, it's very important that you learn how to do that. Then the third element are the goals which should be client oriented. The goals that you make must be client-centered, and these goals, there are two types of goals as well. There are short-term goals and long-term goals. The fourth point or element that you find in the nursing care plan is the nursing interventions. Nursing intervention classifications with specific interventions. Okay, you have to learn how to write down these nursing interventions. Of course, these interventions must be focused on achieving the goal that you've set up. Remember, your goal can be long-term or short-term goal. So the nursing interventions that you'll be carrying out here, they should be directed at achieving the goal that you set. And I think I've mentioned that this goal must be client-centered. I'm going to give you an example of how you can construct your statements under nursing interventions, how you can actually write down your interventions after you've set a goal. So we are going to discuss both the interventions for the actual diagnosis and the interventions for the potential nursing diagnosis. The fifth element is the evaluation. The evaluation stage, this is where you as a nurse now evaluate your nursing interventions. If they were effective enough to achieve the goal that you set in order to end the problem that you identified. Okay, so this evaluation must have an evidence as well. So I'll show you how you can also write down your nursing evaluation, how this evaluation must also have an evidence. There must be something that you've seen that will make you make a conclusion that you've achieved your goals or you've not achieved your goals. Okay, so I'll show you how you can write down your evaluation as well in your nursing care plan. There are three types of interventions. There are three types of nursing interventions. I think it's important that I talk about this. Nurse initiated. These are interventions that you initiate yourself as a nurse. Physician initiated. These are interventions that the physician initiates. Okay, so you might get instructions from the physician on how you have to carry out a certain nursing interventions. Those are interventions that are called physician-initiated nursing interventions. Collaborative nursing interventions, these are types of interventions that can be initiated by both a nurse and a physician. Okay. Nurse initiated, this is independent nursing intervention or actions that a nurse initiates. These do not require direction or an order from other healthcare professionals. So when we talk about nurse-initiated interventions, these are nursing interventions that you make yourself as a nurse. You make a decision that I have to do this. Okay. If you've seen that the patient needs a bed bath, the patient is dirty, the patient has got what we call self-care deficit, you make a decision that I have to bath the patient. You have initiated that nursing intervention. Okay, physician initiated, these are dependent nursing interventions or action that requires an order from physician or another healthcare professional. So there are certain interventions that you may carry out as a nurse, and these are nursing interventions that may have been an order or a request from a physician or other healthcare professionals. So you carry it out on their behalf as a nurse. Okay. Then the collaborative initiated nursing interventions. These are interdependent nursing interventions or therapy that require combined knowledge, skill, and expertise of multiple healthcare professionals. Okay, so such type of interventions, which are collaborative interventions, nursing interventions, they require almost every member of the healthcare team to be involved for the goal to be achieved. Okay. Under the evaluation, I think I've also mentioned, I've talked about this already. This is where you evaluate all nursing interventions by comparing the client's actual response to the expected outcomes of care plan. Okay, so you just want to see whether you've met your goals of care or not. Okay, if you've not met your goals of care, you might want to revise your plan. Okay, if you've met them, okay, you might want to look for other problems that you have to attend to. So how to write a nursing care plan? So how can you write a nursing care plan? Okay, so I've got a sample question here. I've got a sample scenario with me. Mrs. Chimbala is brought to the hospital with complaint of coughing and difficult breathing. On examination, his skin was warm and dry to touch. She appeared to have a flushed face and her temperature was high, about 38.5 degrees Celsius. A diagnosis of pneumonia was made. How would you nurse Mrs. Chimbala using the nursing care plan? So this is Mrs. Chimbala who was brought to our ward. Mrs. Chimbala was brought to our ward, and we have seen that Mrs. Chimbala has got fever with a temperature of about 38.5 degrees Celsius. And the medical diagnosis has been made of pneumonia. Okay, so how are we going to nurse Mrs. Chimbala? So I want to give you a glimpse of how you have to come up with the problems and the nursing diagnosis. It's very important that you know that. Okay, all right. The problems identified. Mrs. Chimbala has got pneumonia. Okay, Mrs. Chimbala has got pneumonia. So the problems that we can identify are coughing, fever, difficult breathing, flushed face, dry skin. I'll show you how you have to state your problems, because you can't pick coughing as a problem. You can't write it down in your nursing care plan as a problem. And you can't write fever as a problem in your nursing care plan. Okay, so I'll show you how you have to write down your nursing problems. These are symptoms that will help you come up with a problem. I'll show you another way of coming up with a problem using nursing models. Using nursing models is usually very easy for you to come up with the nursing problem, to identify a problem. But now I want to use the signs and symptoms to help you come up with a problem in case you forget how to use the nursing model. Let me share my whiteboard at this moment so that I show you how you should write your nursing care plan. So I'm going to show you how you need to write your nursing care plan here. To be a quick one, just stay with me, to be a very quick one. Okay, so the nursing care plan has got 5 elements. Okay, 5 elements or 5 components. These are the problem, the column for a problem. So you should have a column for a problem. Oh no. It must be smart. Okay, these columns must fit, or the columns and rows must fit in each other like that nicely. Okay, let me just push it a little bit down. I've forgotten something that I need to put on top here. Patient details. Okay, I need to put patient details up there. Then you can write your nursing interventions here. Then you can write your duration at the end. Good. So, these are the components of the nursing care plan, and this is how it's supposed to come out. Okay, but there's something that I have left out here. I need to write the patient's name here, name of the patient. I think that's Mrs. Chimbala. Name of the patient. Then I need to write the nursing diagnosis. Okay. Nursing diagnosis. Sorry, medical diagnosis, not nursing diagnosis. Medical diagnosis. Mrs. Chimbala was diagnosed with pneumonia. Good. So pneumonia. Okay. So if you want, you can include another one here. You include age of Mrs. Chimbala. Okay, so we are going to say she's let's just say she's 35. Okay, she's 35 years. Right, like that. Beautiful, right? Isn't it? Okay, so this is Mrs. Chimbala. Now, I want to believe I'm talking to students here, to students. So as a student, this is how you have to draft your nursing care plan, as smart as this. Now, it's going to be a bit different when you're on the ward, because when you're on the ward, your nursing care plan may have about 7 columns. There must be the first column here for time, and at the end you should have another column for. At the end this side, you should have another column for your signature. So you should have a column for your time this side, the time at which you've identified the problem, and you should have another column this side for signature. After you carry out your interventions, you've done everything, you have to sign here for the next nurse to see that you actually did this and you've signed. Okay, and for accountability's sake, you have to sign somewhere this side. Now, have not included that. Why? Because for you students, the most important parts are these 5 columns. This is where we usually have a challenge. Okay, and these are the graded columns in the nursing care plan of the nursing care plan. When we are marking your essays, we just consider these 5 columns. These are the columns that we usually grade. Okay, so when it comes to grading, actually, this under the problem, we just give about 1 mark. It's just 1 mark. Okay, 1% when it comes to grading. That's how we grade. Then for the diagnosis, we give 2%. Okay, good. So these are just the gradings. I just want to show you the gradings, of course, of the nursing care plan. The problem that you've identified is usually given a 1% when we are marking. The nursing diagnosis is given a 2%. Nursing goal is given a 2%. Interventions are given 4%, and that's 1% each. So you are just expected to write about 4 interventions under each problem, which will give you 4%. Okay. Then evaluation, we usually give it 1% only. So what information are you supposed to write? Now that you've known how we grade the nursing care plan, now what information are you supposed to write? So this is what you have to write under the nursing care plan. So let's identify a problem. Mrs. Chimbala came with pneumonia. We know that pneumonia usually presents with difficulties with breathing. That is one of the cardinal symptoms of pneumonia. Or what problem are we going to identify? Our problem will not be dyspnea or difficulties with breathing. We should not bring out our problem like that. what will be making this patient have difficulties with breathing? Okay, so this is how we are going to state our problem. Ineffective airway clearance. This is my problem. The problem that I've identified that Mrs. Chimbala may be suffering from. Okay, ineffective airway clearance. So I'm going to label this as problem number 1 for me. Why do I say ineffective airway clearance? You know why Mrs. Chimbala is having a problem, is having difficulties with breathing. When Mrs. Chimbala has got difficulties with breathing, it's either he's having challenges with clearing his airway. Of course, well, we expect her to have some secretions. She's got pneumonia, so we expect her to have some secretions, and she might be failing to expectorate or to clear her airways for her to have adequate oxygen in her lungs. Another problem, and another way you can coin your problem under this one is we do not want to bring dyspnea as a problem here. We don't want to bring dyspnea as a problem. Your nursing interventions are usually directed towards eliminating the problem that you've identified. Now, if you say difficulties with breathing, is that a problem that you can eliminate? You can help the patient effectively clear their airway in order to have adequate air entry into their lungs. Okay, but you cannot. This patient is having ineffective airway clearance, and you are actually observing it. You've seen it because they have difficulties with breathing. Okay, that's why I don't want to bring out difficulties with breathing here as a problem. That's going to be our evidence. Okay, so apart from this one, I said the other way you can bring out a problem here is by saying altered gaseous exchange. Altered gaseous exchange, we know this is at the level of the alveolus, the alveolar. Okay, meaning there is a problem. The patient is breathing in, of course, but there is something blocking the exchange of gases at the alveolus, at the alveolar level in the air sac. Between the air sac and the blood vessels, there is that exchange of gases is not taking place because fluids have accumulated in the alveolus. We are talking about a patient who has pneumonia. This one is it's a very good nursing problem. It's a very good problem actually, but you may have challenges coming up with your nursing interventions, but we are going to see how we can handle it. Okay, there are other problems that the patient may be suffering from, of course, problems that you can easily identify as well. We have anxiety. You just have to bring it out the way it is, as anxiety. No two ways about it. Okay, it's a problem on its own. Anxiety is a problem, so you just have to bring it out the way it is, with nothing to change about it or anything to add. Okay, so you bring it out just the way it is. Anxiety as a problem. This is a patient with pneumonia. The patient is having difficulties with breathing. Okay, he's got dyspnea, and that's going to make him anxious, apprehensive. Okay, he's going to be worried. Is a patient who is struggling to breathe, so he's definitely going to be anxious. So you have to talk about anxiety here. It's very important that you handle the patient's anxiety always. So here we are looking at the emotional or the psychological state of the patient. Okay, we want to handle that part as well. And for it's also good for us because our patient is going to cooperate with us with us if we handle his anxiety. If we ignore the anxiety part, we just focus on the disease, the patient may not get better. Actually, they may have a challenge even working with you. Okay, you have to involve the patient in your care. So apart from this, there are other problems that the patient can have actually. We said the patient has got fever, about 38.5 degrees Celsius of temperature. So what problem can we identify from that? So what we can say is we do not want to bring out fever as our problem. That is not allowed. Okay, You don't have to say fever. That's not a problem. Fever is a sign and symptom. So don't say fever. I hope you're getting me. You don't bring it out like this. It's not allowed. Okay? It's not allowed to bring out fever as a nursing problem. In place of fever, you can say altered thermoregulation. Okay, altered thermoregulation. Okay, so now the main job is going to be on the nursing diagnosis, how you have to write your nursing diagnosis from this problem. But this is what you have to write. Don't write fever. Okay, fever is going to be your evidence. Fever will be your evidence. So this is what you have to write. Fever is going to be your evidence. This is what you have to write. This is not allowed. And you have to write this as well. You can write this, you can write this as a problem. Let's see how we can write the nursing diagnosis now. I'll just write the nursing diagnosis for one here, then I'll discuss this later. So let's talk about the nursing diagnosis now. How do we write the nursing diagnosis? Our first problem is ineffective airway clearance. So what is our nursing diagnosis? You have to pick the same statement that you've written there, ineffective. What is causing this ineffectiveness in airway clearance? That's your cause. So you have to say related to or due to. In place of related to, you can say due to. What do you think will cause this ineffective airway clearance? Okay, that's what we want to write here. So we can say ineffective airway clearance due to chest pains and thickened mucus. Evidenced by, because it's an actual problem, you have to write the evidence as well. Okay, so what's our evidence here? What can we see that is telling us that this patient has got ineffective airway clearance? Evidenced by wheezing sounds. That may tell us that there is some blockage in the airways. When you are writing a nursing diagnosis, you can actually have a lot of causes for the actual diagnosis. You can have a lot of causes for both actual and potential. You can have a lot of causes. Here, I've just written two causes: chest pains and thickened mucus. These are the things I feel will be causing this ineffective airway clearance in the patient with pneumonia. Okay, in Mrs. Chimbala. What's my evidence? You can also have a lot of evidences or things that will be telling you that this patient is failing to clear their airway. Okay, so you can have wheezing sounds or ineffective coughing. What I mean is that my patient is ineffectively coughing. Because of this ineffective coughing, the patient is failing to expectorate the mucus, and this mucus keeps on draining down into their lungs. Okay, now what's making this patient to ineffectively cough? It's because of the pains and the thick mucus that they have. So this is causing the ineffective airway clearance problem. So this is how you write down your actual diagnosis for the actual problem. I hope this helps you to understand what a nursing problem is and the nursing diagnosis is, and how you have to write your nursing diagnosis from the nursing problem that you've identified. Okay, so this problem can fetch you, this diagnosis can fetch you 2 marks. Why? Because you've put everything that is required here. There's an evidence. This is what we look for most of the times. I want to show you how you can write your nursing goal now, your goal. We have identified the problem, we have written a diagnosis. Now let's write the nursing goal. What's our goal? What's going to be our goal? We want this patient to have effective airway clearance, right? Good. So your nursing goal must be patient-centered. It must be realistic. By realistic, I mean it should be a goal that should be achieved. Time frame must be realistic. It must be time that can actually work if you carry out those interventions. But for example, you cannot set a goal to make the patient gain weight or 2 kgs weight in 1 day or in 2 days. That's not possible. That's unrealistic. Okay, so the time frame with which you want to achieve this goal must be realistic. It should be making sense. Okay, so here my patient is having a challenge with breathing. They have ineffective air clearance. This is an urgent case. So I want to make sure that this patient of mine is able to clear their airways at least within 24 hours. My patient should be able to clear their airways. So the patient will be able to clear her airways within 24 hours of my nursing care. So your nursing goal must have your target. The target is the patient. And what you want your patient to achieve. And the time frame must be there. Okay. So I personally feel this time frame is realistic and my patient can actually achieve this goal even before the 24 hours elapses. Remember, I've put this is within, okay, within 24 hours of my nursing care. So it can be 2 hours from now, 3 hours, 4 hours, but within 24 hours. 24 hours should not elapse. My patient has not yet started breathing properly. I should make sure that, I want to make sure that within 24 hours, my patient has started breathing properly. Okay, that's what I mean with this goal. Let's look at the interventions now. How can you write your intervention? So, okay, for this goal, I think I would say this goal is just, it's a short-term goal. This is my short-term goal. Okay, this is my short-term goal. So I want my patient to achieve, to be able to clear her airways within 24 hours. Okay. There's another way. There are a lot of ways of designing your goals. I can still paraphrase this statement and come up with another goal. Okay, just play with your English. Okay, as long as the main aim is that the patient is able to clear her airways or the patient is able to breathe properly. So my intervention is now. Sorry. Let me show you another part. What we don't want. What we don't want under the nursing care plan. This is not what is not acceptable. Okay, let me show you what is not acceptable under the nursing care plan. Something that most of you students usually write. Okay, to make the patient clear airways within 24 hours of my nursing care. Now, I want you to notice the problem here, the difference between these two statements. The difference between these two statements is that the first statement here, which is the patient will be able to clear her airways within 24 hours of my nursing care. This statement is focusing on the patient's outcome, what you want your patient to acquire at the end of your intervention. Okay. Now, for this one, it's focusing on your nursing and on you as a health personnel, what you want to acquire. Okay, to make the patient, you want to make the patient, you as a nurse, you want to make the patient clear her airways, meaning it's your goal as a nurse. This is what you are setting for yourself after you carry out these interventions. This is what you want to achieve as a nurse. It's not patient-centered. Okay, meaning you are isolating. You are actually being selfish. You are focusing more on yourself than the patient. So these two they both sound okay, but the second one is wrong. You should not write your nursing goal like this. Okay, don't write your nursing goal in this manner. I hope you are following me. Don't write your nursing goal in this manner. This is not advisable. It's not acceptable. Okay, this isn't acceptable. Don't write your nursing goal in this manner. Good. Okay. So this one is acceptable. This one is very much acceptable. Okay, no. All right. So for the nursing interventions, let's see. Oh, no. Nursing interventions, let's see what we can write under nursing interventions. So nursing interventions, what do I want my patient to achieve at the end of this? Oh, sorry. For the nursing interventions, I have to talk about what I will do for the patient. So we also have a way of expressing ourselves under interventions. Okay, you have to say, I will. You have to begin with I will. Always, when you're writing your nursing care plan, begin with I will do this and this and this. And your interventions must always have a rationale for doing that. Okay, you should have a rationale for doing that. So what will I be doing here for me to help my patient be able to clear her airways? So what am I going to do? Okay, so I will in order to drink to help soften the mucus for easy expectoration. So if you see this nursing intervention, it has what I would do, and it also has my rationale for what? For giving the patient what fluids. My rationale is that I want to help soften the mucus for easy expectoration. Okay, because as the patient is taking those hot fluids, they will be able to at least warm up the trachea and the chest. Okay, those hot fluids at least will be able to warm the trachea and soften some mucus that will be and it will be easier for the patient to expectorate them. Okay, so remember here you have to write about 4 nursing interventions. So you have to write 4 nursing interventions under the column for interventions. Okay, so the other intervention that I can write for this patient is that I will teach. Okay, let me see. I think I have to teach my patient about some effective coughing techniques so that he'll be able to expectorate, of course, to expectorate the mucus. But let me think of another one. Let me think of a better one, a better intervention that I will carry out here. Okay, apart from that, there is some medication that you can give to this patient to help relax the muscles. Okay, some muscle relaxants you can give. No, let me not talk about that for now. Okay, the other thing that's making this patient fail to expectorate properly, I think we talked about chest pains. Okay, pain that the patient has is making him fail to cough effectively. So I'm going to administer analgesics. So I will administer prescribed analgesics such as, so you have to put the drugs that you are going to administer here. Okay, which drugs can be prescribed for this type of a patient? Okay, the patient can get paracetamol, they can get brufen. Okay, so I'll just go for paracetamol for now. Paracetamol 1 gram. I will administer prescribed analgesics such as paracetamol 1 gram to help to relieve chest pains and let the patient be able to cough effectively. To relieve chest pains for the patient, or let me delete this one. This is English, people. So for the patient to be able to cough effectively. Okay, so that's my rationale for giving an analgesic such as paracetamol. So that's my rationale for giving analgesics is for giving paracetamol as an analgesic. I want to relieve the patient of the chest pains that they have, so that they are able to cough effectively. Okay. Yep. So this is what I will do, and these are good nursing interventions. Okay. Now, what's going to be my evaluation here after carrying out? Okay, so I'm not done with the nursing interventions here. I need to write about 2 more interventions. I'm going to leave that with you. I'm going to leave that for you so that you can come up with the remaining 2 interventions for this problem. Okay, so the other part we have to look at is the evaluation part. Evaluation. Under evaluation, we want to see if our interventions have met the goal to solve the problem that we've identified. Okay, so again, we have to begin with patient. That's after within 24 hours, we have to evaluate if our goal has been met. So patient is effectively clearing her airways, evidenced by adequate cough and normal breathing patterns. Okay, normal breathing patterns and absence. You can write this as you want. Just make it fun as you write, okay? And absence of wheezing sounds and what? Yeah, okay, and absence of wheezing sounds. Okay, so yeah, that's my evaluation here. So this evaluation has got an evidence which is very important. So patient is effectively clearing her airways, evidenced by adequate cough and normal breathing, okay, or let me say normal respirations, okay, normal respirations, and absence of wheezing sounds. Okay, yeah, that's much better. Absence of wheezing sounds. So this is my nursing care plan for the diagnosis of ineffective airway clearance. So now, as you write now, okay, let me just take these down. Let me take them down so that I show you something again. How you have to, okay, let me just delete this for now. I think you've seen the concept. Let me delete this. We create space. Or delete this. Before you go to another diagnosis that you want to attain to, you have to now make a demarcation. Don't just put everything in one row. So you have to demarcate. Okay, make a nice demarcation like that. Make a very nice demarcation like that. Just make sure that you've done this one. As you go to the next problem, if you want, you can extend those now. If you want to start writing on another problem, you have to extend these like that. If you want to discuss another problem that you've identified, you have to create another row. Okay, so you have to demarcate like I have done it now. Then you have to write about something now here, and a different one now, a problem, anxiety. So if you bring anxiety like that, then you have to write your everything down, everything along this row again in each column. Okay, so that's how you write it down. In the next session, I'm going to show you how you can actually come up with a risk diagnosis. For this presentation, I end here. It has gone beyond what, my time limit. I wanted it to be just less than 10 minutes, but I've spent so much time. So next time I'm going to discuss how you can write or the risk factor. Okay. Thank you so much for watching our video. Please remember to subscribe to Graduate Stars on our YouTube channel. That's the only way you can support us. For subscription, it's actually free. Subscription is free. Thank you so much for watching. God bless you.